Okay, today we're going to be doing an IV piggyback. So I'm just checking the provider's orders. Looks like this is for Steve Rogers from Dr. Strange. There's an order for normal saline to already be running at 30 mils per hour. And then there's also a secondary order for vancomycin, 1,000 milligrams over 200 milliliters to run over an hour and a half. So I'd go into the patient's chart, just verify that any lab work, any medications they're on, any diagnoses that they have, that there's not any complications with the medication that we are running. And there's not, so I'm gonna go ahead and make sure I have all my supplies and let the patient know. Hi, my name is Avery. I'm gonna be your nurse today. Can I verify your name and your date of birth?
Steve Rogers, April 29th, 1992.
Okay, perfect. And I just paused the saline line because it was beeping. It says that there's air in the tubing, even though there's not. Perfect, Steve. Well, we are going to be giving you some IV antibiotics today. It looks like you already have an IV running, and it looks like it's running well. Is there any pain? Have you noticed any leaking or anything, like any swelling at the area?
Nope.
Okay, awesome. Well, it looks like it's currently running well. If it was infiltrated, which means that the fluid is just running outside of the vein, then we'd pull out the IV, stop the medication, and find a new place to put your IV. But again, it looks like it's running well now, no signs of redness, swelling, and it's pain. So we're gonna keep using that. Do you have any allergies that you're aware of?
Nope.
Okay, awesome. I'm gonna go get the medication and get that started. I'm just doing some hand hygiene and putting on gloves. The first thing I'm going to do is I'm just going to get all my supplies out. I'm going to lower the saline bag because I want the antibiotics running first, so I'll place that higher. And then I'm also going to spike the bag and prime the secondary line and make sure that I don't lose any fluid. So right now it's clamped, so I'm going to hang it up, and then I'm just going to prime the line, making sure that I don't waste any fluid. Perfect. Okay, so now what I'm going to do is I'm going to get an alcohol wipe, and I'm just going to clean both the secondary tubing and where I'm going to connect it above, and wait for those to dry. And then I'm going to connect these. I'm going to unclamp my saline, or my vancomycin, and I'm going to make sure that everything is unclamped currently, which it looks like it is. So now that I have the vancomycin line primed, that it's connected to the saline, I'm going to go to channel select, and I'm going to add a secondary, and I'm doing vancomycin, and I'm just referring to the provider's orders that it is 1,000 milligrams over 200 milliliters IV piggyback for an hour and a half. So I'm going to select that dosage and verify that it is correct. And I'm also, before I start anything, going to do my 5 patients' rights, making sure that it's the right medication for the right patient, it's at the right time, right route, and it does not expire until 2026. So now that I've confirmed all of that, I'm going to click start, and that should be running now. So everything looks good. There's no air in the line. All the clamps are open. But now that we have this medication going, I'm going to perform hand hygiene after taking that off. I'm going to pause this again, even though there is no air in the line. We just want to make sure that you watch out for any signs of adverse reaction. So some of those things could be like an allergic reaction, itchiness, rash, difficulty breathing. Could also be vancomycin flushing syndrome. You could have like hot flashes, redness, and itching of the face. So we just want you to be aware of those signs, and definitely use your call light if you notice any of them. We're also going to be coming back in and checking on you pretty frequently. Do you have any questions for me at this time?
Nope.
Okay, awesome. Looks like the bed is in low and in locked position, salad rails up, and again your call light is right here. I'll be back soon. I'm just going to go document your IV, the teaching that I shared with you, and the medication that was started. Thank you.